I'm Jan. I'm originally from Alabama, and I was diagnosed with GVHD in 2014. Before my diagnosis, I had the best job as a nurse. I was a PIC nurse. I started a PIC team at the local hospital, had my own office, loved seeing my patients. I wasn't feeling well, and I just thought it was because I was in my 50s. But I wound up having a rare form of blood cancer. I was diagnosed with JAK2 positive primary myelofibrosis. They were like, you need a stem cell transplant as soon as possible. And the actual stem cell transplant was on April the 24th of 2014. My transplant team didn't tell me much about GVHD. I think because I'm a nurse that they made some assumptions that I knew things that I didn't. They did tell me to be sure and let them know if I had any unusual rashes. My transplant team never really said anything about symptoms related to GI or your heart or lungs. They were constantly, wanting to look at my back and my skin and feet, but I didn't really know what to watch for in other areas. My doctors first talked about GVHD, and I learned the most about it after I was diagnosed with it. And I actually had to fight to get diagnosed. I just kept telling them I'm losing weight, I can't eat. They just kept telling me, we'll keep trying, it's just the chemo. And I'm thinking, this is June, the chemo was in April. Surely it's not that. But it had to reach the point where I no longer could keep clear liquids down. And I had problems with ulcers in my, going down the back of my throat and into my esophagus. I was admitted to the hospital. It was GVHD of the GI tract. If it had been a skin rash, I think they would have caught on to it much quicker and would have told me, you have acute GVHD. But everything that I had, it didn't fit in their box. When they diagnosed me with acute GVHD, they started the steroids, and it was almost an instantaneous fix. I felt better, I was hungry, I was doing great. I came home on oral steroids. Over July and August of 2014, they tapered the steroids down, and I seemed to be doing fairly well. But starting in September, I started feeling real short of breath with exertion. They kept encouraging me to just build my strength up, to try to do more every day and, stay active. And then by December, I just by chance happened to see a different doctor in the group. And I said the same thing. I've been telling them that I was short of breath on exertion, but I think I added that time. I can't even fold a load of towels sitting in my recliner. I have to stop 2 or 3 times to rest and catch my breath. So they finally decided there's something really wrong with her. After they diagnosed me with the chronic GVHD, I asked the nurse practitioner after the fact, I said, what could I have done differently to let you know that I really was having a problem? She said, well, you were always so positive and cheerful, and when you said you were short of breath with exertion, we didn't think it was that bad. And I'm thinking to myself, well, if I had been whiny and complainy, maybe I would have been diagnosed sooner and had intervention sooner. Anything, even if it doesn't seem to you to be related to the problem, if it's anything out of the ordinary, tell the doctor. It's been almost 9 years since my transplant, and the chronic GVHD, my heart, that seemed to resolve once they got all the excess fluid and the inflammation in there finally settled down. My lungs themselves are in pretty good shape when you listen, but I wheeze a lot and I'm very tight in my upper airways and have to use a lot of different medications to handle that. all the different things that can be affected, the 2 types of graft versus host. I didn't know any of this. If I was talking to somebody that was about to get a stem cell transplant, I would probably tell them one of the best things you can do for yourself is to stay positive, educate yourself about this process. But if you have to whine and holler at your doctor, do it. I don't know if my lungs would be as bad as they are now if I had been heard and gotten treated sooner for the chronic GVHD. Tell the doctors and the nurses everything, and if you think they don't hear you, say it again. Say it in a different way, or even tell them, I don't think you're hearing me. I don't think you're understanding how bad this is for me.